Afternoon, everybody. We're going to be getting going in about 1 minute. 1 minute until we start. Okay, good afternoon, everybody, and welcome to the second in our series of the Performance Puzzle webinars. I'm Gary Cookson, and I'm your host and presenter for the next 30 minutes. What we're going to be talking about today is the subject of well-being. But as a little bit of introduction today, if you've not joined us on the previous webinar, I should explain what we're doing. Firstly, a little bit about me. If you've not met or come across me before, I've worked in HR now for over 20 years in senior roles in lots of different sectors. I get involved in lots of delivery of learning, qualifications, keynote speaking. I have my own blog and website, and I have a young and growing family. In fact, you see 3 of my 4 children there. The picture with the 4th one's not been updated yet, as he's only 2 weeks old and kept me awake for 3 solid hours last night. So I think we're all lucky to find me awake at this point in the day. So hopefully I can keep going for the next 30 minutes. And I'm delivering this today in conjunction with MOL Learn. Information there about MOL, who are part of the LTE group, and MOL deliver a range of different qualifications, and that includes CIPD qualifications, which I'm an associate tutor for. And if you want information about MOL and some of the things that they do, then feel free to look that up after the event. And we're doing a number of things today. We've got about 20 minutes of content delivery and around about 10 minutes then for me to answer questions. That's a fairly flexible model. We're going to be using Twitter today as well. If you want to tweet out using the Performance Puzzle hashtag, feel free to do so, and we'll pick up those either at the end of this session or afterwards, and we'll send a document out which will share some of the responses and some of my thoughts on those. We're using GoToWebinar today, and we'll be doing a couple of polls through the first 20 minutes, but also we'll be using the questions panel as well. So if you want to type in your questions in the questions panel, we'll try our very best to answer them during the session. Any that we don't get round to, we'll send out a document to everybody afterwards with all of my answers, but we'll also use it by way of a chat panel too. So if there's anything that you want to just type into, to react to, give us a view on, it doesn't have to be a question, it just can be your opinion on things. So use questions to type your reactions in as well. So what are we doing today? Well, the Performance Puzzle series covers a range of different things, and some of you joined us for the last session too, where we looked at work-life balance, but today we're looking at health and well-being. And specifically today, we're going to be covering a few objectives. So we're going to be looking at 3 things. We're going to look at the impact of well-being on corporate life. We're going to look at the business case for investing in well-being and how organizations can make that case. And we're going to look as well at examples and some case studies that I've got from my own experience, and some that have been shared by the CIPD and others, of successful wellbeing initiatives. So those are the things we're going to be doing today for the next 20 minutes or so. And keep the questions coming through in the questions panel and tweet out using the Performance Puzzle hashtag, but we're ready to go. So when I started putting this webinar together, I was faced with the question, how do you even define well-being? How do you understand what it is? We talk about it and we say it's very, very important in the workplace, but it's a really difficult thing to define. And I don't think there's one universally agreed definition here. And if you've got your own, it'd be interesting to see that. So by all means, pop it in the questions panel or tweet out using the Performance Puzzle hashtag. But it's a really difficult thing to define. And I think there's a range of different definitions, but there are possibly some common themes. And one of the other things that people often struggle with is, even if you can define it, how do you measure it? Because well-being is something that's very individualized, very subjective and personal to every individual. So it's very difficult to get a collective measure of organizational well-being. So if we can't really define it, and we also struggle to measure it, why is it important? And that's the question we're going to try and answer today. And I think if we have access to more and more information about our health and our well-being, and access to lots of research that makes the link between healthy employees and productivity, I do wonder why we're struggling to make a dent in many of the health and productivity related issues that we face at work. So we're going to have a look at some of those today. And to start us off doing that, we're going to launch a poll. And the first poll is going to appear on your screen shortly. And it's this question here. Does your organisation have a staff wellbeing strategy or plan? And a range of different answers for you to choose from. Yes, and we see the benefits. Yes, but we can't see the benefits. No, and we don't see any benefits. And no, but we want to. So this poll should open up shortly for you on screen. And you should be able to just vote at this point. And I can see the results coming in. And when we've got most people voted, we'll be able to close the poll and share some of the results. But it'd be interesting to see here the range of organisations that do have this in place, and some of the ones that maybe do but aren't seeing the benefits and are struggling to really make it work. And that's been my experience in some organisations too. And looking at some of the results here, we've got around about 4/5 of people have voted at the moment. Just going to keep it open for another 20 seconds or so, and then we'll close it. And then we'll share the results. But it's interesting that there's a spread already across all 4 answers, and you'll see this when this closes in about 10 seconds time. I think it's presented a number of issues for organisations here, and I think we can close that poll now. Most people have voted already. You should be able to see the results showing on your screen. And the poll results are showing quite interesting there that a quarter of people are saying that yes, they have a wellbeing plan and they see the benefits, so it's working. There's 10%, 11% of people who are saying, yeah, we've got one, but it's not really working for us at the moment. 7% are saying, no, we haven't got one, and we don't really know why we would want one either. And so this is a really good webinar for you to be on. And we've got well over half of the respondents today telling us that they haven't got a wellbeing strategy in place, but they like one. And again, this is a good webinar for you to attend to get some ideas for this too. So thank you for sharing that one. So let's move on. I'm going to share some statistics with you today. And firstly, I think let's have a look at this one. This is a gov.uk survey that was done in July 2015, and I think it's clear that we do have a problem. This survey gives us a useful overview of the scale of issues that are presenting themselves to us as employers, and I think it's clear here that having a supportive employer and discussing health conditions at an early stage, they're associated with being less likely to go off sick for a long period of time, certainly. So what can we deduce from that? Around 1 in 10 people have a condition that they are hiding from their employer. And around 1 in 20 people have a condition that's not only hidden, but it's affecting their work too. But that if people tell their employer about it, it's likely they're going to get some help, but most don't want to tell their employer about it. And I wonder whether it's always been that way. I suspect not. I think what we're seeing nowadays is a greater level of understanding and reporting on health and wellbeing issues for a variety of reasons. And prominent amongst those is the amount of data that you get about yourself. If you've got a Fitbit or a smartwatch or something like that, you get loads of information from your wearable technology, health apps, loads of information available online. So it's becoming a much more visible issue for people. But I wonder how many people actively use this information for their own good. I think probably a minority only do that. But it's clear to me that if employers could convince people to do so and could help them to do so, the benefits are there to be reaped by both parties. And there is a clear link between productivity and performance. The CIPD, I've shared some stats, and you can see some of these here and some more stats from the YouGov survey. The CIPD have got their own fact sheet, which we'll share after the event if you want to look it up, which was published in January 2016. Gives us information about the 5 domains of well-being, which they call health, work, values, social and personal growth. Now these areas are good, gives you a nice structure if you're looking to put in an approach to improving health and well-being. this tells you how to do it. It's really good. But so does the IIP Health and Wellbeing Framework. So does the Virgin Pulse Global Challenge. So does lots of stuff from ACAS. There's loads of structured frameworks for us as HR professionals to use. And we're really ideally placed in HR to influence organizations and improve well-being. And employees who work for an organization who have a well-being strategy, so in our last poll, that's about a quarter of us, then we're twice as likely to believe that our employer genuinely cares about our well-being. And levels of employee engagement rise by about a third amongst those employees. But very few organizations have one, particularly the smaller organizations. And I suspect, if we look at the poll results, that most of the people who said no, we haven't got one, were quite likely to be in a small to medium-sized organization of 250 or less staff, and that's usually the case. So let's have a look at another poll now. So the second poll we're going to do today is this, and this should open on your screen shortly. What are the reasons why? What are the barriers to even more effective well-being? And hopefully this poll will display and allow you to pick as many of these as you can. But if you're only able to pick one, then pick the top one for you. So this poll should open shortly. Number of things that might be getting in the way: pressure of work, line management attitudes, lack of senior support, staff not interested, not sure how to even go about it, or something else. And if there's a something else, then pop this in the question panel and we can pick it up that way. So I'm starting to see people voting already. About half the people have voted. We'll keep it open for another 20-30 seconds or so. But there are plenty of ways in which managers and senior managers can support well-being amongst the teams. Managers can go on the training themselves to understand what to do. Managers can respond promptly to concerns or signs that people are struggling. Organizations that have senior sponsorship can support employees of health issues. They can tackle presenteeism. They can make sure people are taking their holiday entitlements. They encourage others to take part in wellbeing activities, giving them time and space to do it. And simply sometimes by just listening. So we can close that poll now because almost everybody's voted, and we can share the results of this. And it's interesting from the results I can see and that you will see in a second, that these results are fairly split amongst all the different things we've got. And I can see a couple of people popping things in the questions panel as well, saying cost might be an issue as well. And of course it might be. So things to do with the resources available too. But the poll results are quite interesting, that lots of people saying it's pressure of work, lots of people saying it's to do with management, whether that's line management or senior management attitude and involvement. Some people saying staff are not interested as well. And that's something I came across maybe 12 or more years ago when I first started dabbling in employee wellbeing. Lots of staff weren't interested, but there's ways and means in which you can get them to do it. And around a third of people saying they're just not sure how to do it. So again, this webinar might give you some ideas, and we're happy to talk to you afterwards if you've got further ideas. What I'm going to move on to now is a few case studies that might help you to figure out how you do it. And this is one that is from my own experience. This is an organization that I used to work for, and we took part in what was then called the Global Corporate Challenge, but is now called the Virgin Pulse Challenge. Many of you will have heard of it. If you've heard of it, you know all about it. And if you've not, then look it up and Google it and have a look at it. It's a really good annual competition you can get involved in. And at the end of it, we got some interesting statistics from about 100 staff who were involved in this, who were participating. And 85% of them reported they took more accountability for their own health. 78% thought exercise was more enjoyable in the workplace. 72% reported increased activity levels. 82% reported that they had a better understanding of how to become healthy. 62% reported losing weight, and around the same percentage said they were undertaking 30 minutes of planned physical activity 4 times a week, and that was up from 27%. 70% of employees reported a decrease in stress at work and an increase in their energy levels. 26% of employees reported an increase in their productivity, and a whopping 80% of the employees who took part were more aware of our commitment to health and well-being. So going full circle to the original report, the gov.uk report we discussed about 5 minutes ago, My organisation suddenly unlocked greater productivity from about a third of our staff that were involved in this, and 3/4 of them had greater awareness of our ability and willingness to support well-being. So that meant we were much less likely to have people hiding away from us and hiding their issues from us. And in short, it worked. It made fitness fun. It raised awareness of well-being, and it was a gamified approach to health and well-being. So there were league tables, there was team-based challenges, there were some really great things. It didn't cost a great deal. It didn't take up much time, and it was a nice way of getting people involved. So I'd encourage you to have a look at the Virgin Pulse Challenge. It normally starts around this time of the year, so you're probably too late for this year if you haven't joined it. But have a think about it for next year. It's certainly worthwhile doing. But I've got another question for you now. We're not going to do this as a poll. This is more a question, really. I'd like you to tell us in the question window or tweet out using the Performance Puzzle hashtag, what have been the most effective things that you've seen organizations do to impact well-being at work? And I think there's loads of things that you can do. There's a peer of mine who works for the University of Manchester, and they're heavily involved in promoting a wellbeing program. The University of Manchester are really good at promoting things to do with health and well-being. So they do things like walk-in meetings. They do lots of gratitude, saying thank you to people, giving people a positive boost. They do lots of lunchtime activities and give people time to do things. There's lots of things they do about healthy choices, about instead of biscuits in the workplace, bring fruit and so on. And that applies to vending machines and canteens. But it's more than that. You can do lots more things. Talking about well-being is a really good thing to encourage well-being, making it sort of visible. And one of the great things that we in HR can do is simply talk about it and make it a common topic of conversation. If you can see the signs and the symptoms of an employee who's struggling, whether that be on a mental level or a physical level or any other level, then talk to them and have proactive conversations and let your team know they can discuss wellbeing issues with you and with each other. I encourage people as well to get out of the office, take time away from the workspace. Just a few minutes is good. Sometimes it is tempting to eat lunch at your desk, but make the effort to take a proper break. And then I'm a personal trainer in my spare time as well, so I can talk to you as well about nutrition and eating and drinking properly and making sure you're fueled up properly and so on. So drinking lots of water. We might not always fit in the mythical 8 glasses a day, but try and keep your hydration levels up and have some healthy snacks with you, things like that. Flexible working has a big benefit too, and I talked about that in the last webinar that we did. And think about the notifications that you get as well on your mobile device or on your emails. You can turn them off. Everybody's used to having them. Notifications from social media, requests for 5 minutes of your time. It's okay to turn them off if you need to focus or if they're causing you stress. So start to think about ways in which you can manage your own mental state. And there's loads of apps you can download as well about mindfulness and managing stress. And there's a good one called Headspace. And so have a look at Headspace and download the free trial of Headspace to see what kinds of things you can look at there. Some good examples coming through in the questions panel: lunchtime walking groups, mental health phone support, free fruit, thank you cards, Pilates classes, steps counting, loads of things coming through. So thank you for some of those examples. I'm going to give you another case study now, and this one is from an organisation called South Liverpool Homes, and I can name them because they feature in a published CIPD case study. So you can have a look at South Liverpool Homes in the CIPD fact sheets and reports on wellbeing at work. They're a top-rated organisation, and they did a lot of things to embed wellbeing into their organisation. They had a long-standing wellbeing program, but it wasn't embedded at first. It wasn't supporting the corporate plan. It was limited, and lots of employees weren't interested. So they did a few different things. One of their corporate objectives became something called Every Person Positive. And they started to build activities and objectives and plans around being positive. They widened the scope of their wellbeing program too. They realized that the hygiene factors, so think about your Hertzberg theory of motivation, your hygiene factors were having an impact on well-being. So there was work to do on things like terms, conditions, policies and things like that, and less work to do on workplace well-being activities. So they made sure that they focused on some of the right things rather than some of the fancy and more visible things, doing things behind the scenes. They also give everybody a well-being payment to be spent on anything that falls within certain criteria. And of course, they do things like resilience classes, nutrition, health checks, flu jabs, free fruit, things like that. But they've got loads of benefits too. They report customer satisfaction being up 90%. They report employee engagement being up 15% and absence being down 15%. And they see some unintended benefits too around teamwork. So teams make healthy lunches for each other and they compete for the best lunch, and lots of other things are around in South Liverpool homes too. So I'd encourage you to have a look at that case study if you want to look at how a reasonably small organisation has done it very, very well with limited resources. So it's worth having a look at that. Coming towards the end of my content now, and I've just got a couple of minutes left of telling you a few things, and then we'll have a look at whatever questions we may have. I've mentioned the CIPD fact sheet to you, and I'd encourage you to look at this. And if you haven't got a link to it, then we'll send it out afterwards so that you've all got the link. But the CIPD say a few things: that investing in well-being can lead to greater resilience, innovation, productivity. They tell us what I've said earlier on, that HR professionals are key to making well-being happen in the workplace, but also good leadership and management is key as well. That you can't just drag and drop a well-being strategy from another organization or something you've seen done well elsewhere. You need to tailor it very well to what your organization's needs and characteristics are. Now, I confess that I'm a bit of an evangelist about fitness and exercise. 10, 12 years ago, I was horribly overweight. I was dangerously unfit at one point, and now I'm the exact opposite. And I preach with all the zeal of a convert. Now, I would happily lead lunchtime exercise classes. Have you ever seen Douglas Renham in the IT crowd doing his lunchtime exercise classes? That would be me. And I could happily insist on all new starters having a full medical and psychological assessment to check out their well-being before they join us. And it sounds daft, but sports teams do it. Not so much the lunchtime classes, but the medical and psychological assessments. Think how Premiership football teams go into the nth degree of detail on new signings. Maybe the corporate world could gain additional productivity by following suit. And I think there's something to that. Imagine if you're going to pay somebody 30 grand a year and you want that person to stay with you 5 years, it's probably worth a couple of £1,000 to get a full assessment done on them to satisfy yourself that the person is medically and psychologically able to give you 100% during those years. I guess what I'm saying is that organizations don't often think about this up front and they wait for problems to occur and then deal with them. But we should think about it up front. We need to treat people like adults, and that unlocks the next piece of the performance puzzle. So that's me done in terms of content for today. I've got time before we finish in about 5 minutes to deal with any questions that may have come across in the questions panel. So I'm just going to come through a couple of those. Lots of examples here about wellbeing programs. I've got another question here about whether the mindfulness programs were well attended, and that came during the slide that I was talking about, the South Liverpool homes case study. And from what they report, yes, they were. And I think if it works for even just a small number of people, it's worth doing. You can change organizations one person at a time. And I think you shouldn't worry if you get limited numbers of people engaging in your program. As long as it's working for them and it's considered a good use of resources, then go for it. I'm happy to take any other questions though in the questions panel if you have them. So feel free to type away. If you've been tweeting out using the performance puzzle hashtag, then we'll get to those after the session, and I'll do a full response to everything that we've got after the event. So you'll get a document over the next few hours or even tomorrow, which explains this and gives you all the links that I've been referring to today as well. So we've been talking today about well-being. We've been talking about how to encourage organizations to do it and some of the ways in which you as an HR professional can do it. I've shared with you a few case studies that might help you to understand how it can be done regardless of the level of resources that you have, and giving you a few ideas about how you can encourage it in the workplace. Please continue this conversation with us. If you want to tweet me, feel free to do so. I'm at Gary_Cookson. You can tweet at MOL Learn as well. We'll be pleased to continue the conversation with you. And if you want to learn more about what we do in MOL, then feel free to get in touch. And a question here from Ruth. So, do we mean medical screening pre-employment? Yes, I do. I think I was talking about the way that Premiership football teams, in fact all football teams, do a full medical, and I think it's money well spent to do it, given that the amount of money you're going to be paying that employee to do it. Lots of organisations will do pre-employment checks, and that may include a medical check, but they're often paper-based versions of this and don't involve a full assessment of the individual. But if you're finding issues that you may see impact on that person's productivity, it's better to know that before they start. I'm not suggesting that you might say no to employing them, but you might be able to put in place a proper support package that gets them up to full speed sooner rather than later. So I think, Ruth, that's the answer to that question. Okay, so I think I've more or less finished now, so we're a couple of minutes ahead of time. I've got one final question to deal with from Cleopatra about what about discrimination due to medical screening. I think that's an important point, and I think if you can justify it, and I think you could probably justify it on financial grounds alone, that you're making an investment and you want to make sure you get the best from that investment, it's the decisions you make after the medical screening that may cause discrimination, not the fact that you're doing medical screening per se. So it's the information you get back and the support that you put in place for individuals that will be key to this, Cleopatra. And that's the way that I would encourage you to deal with it, is deal with every case on its own merits and make sure that you avoid any discrimination at that point. But it is worth doing that full medical check. It's money well spent. So that's the end of today's webinar. Hopefully you're able to join us for the next session in about 4 weeks' time. But we finished for today. So you'll get a document in a few hours' time covering all the questions, all the answers, all the links. But if you've finished too and there's nothing else for you to do, feel free to log off whenever you're ready. But if you want to hang about, we're going to be here for a short while. Thank you very much, everybody. Goodbye.